Can we pretend that airplanes in the night sky like shooting stars? I could really use a wish right now, wish right now, wish right now. Can we pretend that airplanes?
Bravo, Jesus. Jesus.
Hai să-l ții, ține-l, ține mai mult. Nu, așa, bravo. Bravo. Hai și acum să ținem și să facem rochii. Hai să facem rochii, să arătăm mai. Așa.
In less than a day spent in hospital, this patient's eyesight will be restored. Stem cells from the patient's own eye have been harvested on this simple contact lens. This will be placed on the eye to overcome the damage caused by blinding corneal disease. Within weeks, sight will dramatically improve. It's a world-first technique pioneered by researchers at the University of New South Wales and colleagues at Sydney's Prince of Wales Hospital. The novel procedure, which is simple and inexpensive, offers hope to people with a range of blinding conditions that involve corneal damage from infections, burns, and chemotherapy.
Those were just some of the experience of the people who undergone stem cell treatment. Why is there such an interest in stem cells? Researchers hope stem cell studies can help to, of course, increase understanding of how diseases occur by watching stem cells mature into cells that eventually become bones, heart muscle, nerve cells, and other organs and tissue. Researchers and doctors may better understand how a variety of diseases and conditions develop.
Generate healthy cells to replace diseased cells. Researchers hope they can train stem cells into becoming specific cells so that those specialized cells can be used to regenerate and repair diseased or damaged tissues in people. People who might benefit from stem cell therapies include those with spinal cord injuries, type 1 diabetes, Parkinson's disease, Alzheimer's disease, heart disease, stroke, rheumatoid arthritis, osteoarthritis, and multiple sclerosis. Stem cells could be grown to become new tissue for use in transplant medicine. Test new drugs for safety and effectiveness. Before using new drugs in people, researchers could use stem cells to test the safety and quality of investigational drugs. For instance, nerve cells could be generated in order to test a new drug for a nerve disease. Tests could show whether the new drug had any effect on the cells and whether the cells were harmed.
Here's a video of Obama supporting
stem
stem
cell
research.
research remains unknown. Thank you. Thank you.
1, 2, 3, 4.
Thank you very much. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. At this moment, the full promise of stem cell research remains unknown, and it should not be overstated. But scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions. In recent years, when it comes to stem cell research, rather than furthering discovery, our government has forced what I believe is a false choice between sound science and moral values. In this case, I believe the two are not inconsistent. As a person of faith, I believe we are called to care for each other and work to ease human suffering. I believe we have been given the capacity and will to pursue this research, and the humanity and conscience to do so responsibly.
There we go.